You are about to learn one of the most, if not the most important concept when it comes to taking care of your health and taking care of you because truly it's your job to do it. I'm Dr. Sabine Elisée, and in today's video, you are going to learn why blood type nutrition is so important. What exactly is it, and when do I start it? So get ready to learn because I am ready to teach. So, why blood type nutrition matters? Well, blood type nutrition is so important because we want to move away. There are times that we need to use medications, but there's times where we want to use food as medicine. But before I go into that, let me tell you a little bit about myself. I'm Dr. Sabine Elisée, board certified family medicine physician. I've been practicing medicine for the past decade, and I've realized that when it comes to our health, we have to make sure we're not just taking care of our physical health, but are taking care of our physical health, spiritual health, and cognitive health. All three of those components come together. That's what makes you healthy. And over the past decade, one of the most important things I've realized as a primary care physician is that we must remain preventative. Not this sick care that so many people are ascribing to, but preventive care. So, this is one of those teachings that is very foundational to everything that we're going to learn and what we need to know about how you need to take care of your body. So, this is blood type nutrition, more than just food for medicine. So, what exactly is blood type eating? You and I, or just the human race, has four different blood types: type A, type B, type AB, and type O. Now, of course, as you know, our blood is from the crown of the head to the soles of our feet. And our blood also, you might have heard, positive or negative. That's not so important right now when it comes to our blood type eating. But what is important is knowing whether or not you're AB, or O. The foods that we eat have what's called lectins on it. That food lectin is what our blood type recognizes. Now, if your blood type recognizes that food lectin, that food that you're eating, if it recognizes that food, it's able to break it down very, very quickly and now use that food as energy. Now, I always want to remember that food is fuel. So the foods that you're eating, you want to make sure that they're serving you. Now, there's some people that are eating foods that are not serving them, and that's because they're not eating by their blood type. That's what blood type nutrition is all about. So we're going to go a little bit further. I mentioned something called a food lectin. That's what our foods have. They have lectins on it. And our blood types, based upon your blood type, will be able to know whether or not this food lectin is something that it recognizes or doesn't recognize. Now, when it recognizes the food lectin or the type of food that you ate, your body is able to break that food down very quickly and now use the food as energy. If it doesn't recognize it very quickly, what ends up happening with that food is that your blood will begin to what's called agglutinate. It'll clump together around that food and just kind of sit somewhere in the stomach so it can break it down, taking its time to break it down. And you've experienced this before. I'm sure there's foods that you have eaten and after you ate it, you were just tired. Or after you ate that food, you just felt like it's kind of just sat on me right here. Well, that's because your blood type was not able to quickly break down or even absorb that food the way it should. So that's the reason why that food just agglutinated or just kind of stuck together. Now, these blood types that you see here, it lets us know how thick your blood is and how acidic it is. And from here, going this way, blood type O is the thickest, and then blood type A is the thinnest, which also means blood type O is the most acidic, and blood type A is the one that is not as acidic. And when we're talking about blood type O and acidity of food, it means that it could break down heavy, heavy meats very, very well, versus blood type A that has more difficulty, or the food will agglutinate or drain you of your energy if you're eating it because your body's having more difficulty breaking down the food. So that's what blood type eating is all about. We want to make sure we're eating foods that are beneficial for us, not those that we should avoid or don't serve us. And there's also foods that are neutral. It doesn't help us, it doesn't hurt us, but it all depends upon your blood type. So when someone starts eating by their blood type, what can you expect? Well, number one, energy. Because remember, when you're eating a food that your body knows how to break down, it's going to break down that food real quick and it's going to use that food as fuel, which is energy. And now you're going to feel more energized. That's one of the things to expect when you start eating by your blood type. The second thing is weight loss, because as you can imagine, if you are eating foods that your body can't break down very quickly, just like what we mentioned from before, because that food is agglutinating in your body, if it can't break it down very quickly, what does that mean? You're just gaining weight. Here's a quick thing. Blood type O, for example. Individuals who are blood type O, if they are eating heavy wheat products or even dairy, they might find that they're gaining a whole lot more weight, or they might be more tired. Or what I've even seen in office with patients, their skin, they get skin rashes and they have more acne. So that's a really quick one to remember. So blood type eating, again, what can you expect? More energy when you start doing it. Second thing, the weight loss. Third thing, more control of comorbidities. And what are our comorbidities? We're talking about high blood pressure, diabetes, high cholesterol. That's a beautiful thing because now you have more control. This is where we speak about this is more than just food for medicine. Yes, we want to use food for medicine, but now this is really being able to narrow in. Why? Because your body is able to break down the certain foods very quickly and easily, all based upon your blood type. So we have more control of comorbidities, specifically what I've seen in office cholesterol, and even elimination of comorbidities. Now, ideally, this is the thought, but I'm telling you, I've seen it as well before. A young man that I had in office, probably about 2, 3 years ago, he was on depression medication since the time he was 15 years old. When he came to see me, he was about around in his late 20s and was still on those depression medications when he came. When we began to really hone in on blood type eating, when I began to show him how to actually do that, could you imagine? He came off his depression medications and subsequently lost a lot of weight. He lost so much weight, he began to get concerned because he never felt so great. He never saw that his weight was just that low. And he was never in a position from the age of 15 where he did not need his depression medications. So this is why this is the most, if one of the most, if not the most important concepts to understand. If you haven't recognized it yet, I'm a physician, but I'm more than that. I'm a teacher at heart. And I've learned from raising my boys that the more that I teach you the why, the more that I help you understand what is going on, the more you'll better understand what is going on in your body and how to make sure you're taking good care of yourself. So, when do we start? You start now. You start eating by your blood type right now. Again, prevention is key. Well-being is key. It's been said an ounce of prevention is worth more than a pound of cure. An ounce of prevention, it yields that about pound of cure. So you want to start right now. I'll tell you one of the ways I start right now when it's one of those weeks that I have more work to do, when it's busier as a mom, busier as a wife, busier as a physician or business owner, I make sure I'm eating by my blood type and I feel the difference because I have more energy. So you want to start right now and you will see those expectations that we have discussed already. And one final thing I want you to remember always, without your health, you cannot do anything. In my mother tongue, the way that we say it is sans santé ou pas qu'à faire rien. So in these videos, I want you to always remember that. Sans santé ou pas qu'à faire rien. Until next time, take good care of yourself and make sure that you're taking good care of your body. Be a great steward and a great guardian of this temple that you have. See you next time.